Dysmenorrhea is a term we use to describe a menstrual cycle that is very painful, especially during the menses. Amenorrhea is a term we use to describe the absence of menstrual period. In other words, the body starts in a slowdown mode during adrenal fatigue. The body does not want periods because it does not perceive it as a critical piece to survival. So the body will start first with a estrogen dominant type picture where dysmenorrhea or painful periods can be a problem. Now, if this is not resolved, meaning that the body doesn't get what it wants in terms of rest and nurturing back to health, then the next thing the body knows what to do is to shut down the cycle. When the body shuts down the cycle, it is what we call amenorrhea. So dysmenorrhea sometimes is a separate event from amenorrhea, but sometimes it also can be a progression from dysmenorrhea as the body slows down, not a lot of regular cycles, the estrogen buildup, pain becomes more significant, to amenorrhea where the body actually decides that it doesn't want the cycle anymore for a period of time. So this amenorrhea can last for a few months to even for a few years. And it's very interesting because this usually happens in younger women, of course, during childbearing stages. And this is always a pre-menopausal. So you're talking about, anywhere from 20 to 30 or 40 years old woman, that a early menopause is not the real reason, but it's almost as if the body is forcing you into a early menopause. Now, there are many other reasons as well. So anytime this comes on with this type of history, a OBGYN doctor needs to be involved and a thorough workup has to be checked. But oftentimes, a normal checkup will be the end result, and the doctors conventionally will have no reason to suspect anything else. So it is what it is, and the people are just told to go home. But in reality, if you trace it enough, oftentimes there's a close association that we find in adrenal fatigue. So the lesson learned here from the symptoms that I present to you, meaning that this menorrhea advancing to amenorrhea, is really about understanding and looking at the big picture, how the body is dealing with this stress, how the body is trying to slow down, and how the body is trying to use these symptoms of pain and absence of period to alert us of underlying problem. And once you understand this concept, then we will not be so held hostage by these symptoms, but slowly work with fortifying the adrenals properly without making things worse. And as the adrenals recover, you'll be surprised that some of these dysmenorrhea or amenorrhea, in the case of severe situations, will actually go away and the periods start to return. And it's a happy state, as a matter of fact. So we deal with a lot of these people that have this type of situation. And, let it take a back seat. Don't argue with the body. There's nothing you can do to force it to happen. And work on the adrenals. And when the adrenals get better, everything will flow in place. So this is an important symptom, and we use it as a gauge. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.